All right, so what we're going to be talking about today is hip and ankle dysfunction and how to be able to stabilize this in a larger kind of modified way. And what I find, especially with, not just everyday life athletes, runners, is training is all about timing, balance, and coordination. All right, if you're improving that, then you're training. If you're not, you're actually going the opposite direction and possibly going into an injured state. And so what I like to do is when I treat someone, I want to look at the foundation first, because foundation, everything balances itself out as on the way up. And so when you're looking at ankle and hip, I call those both mobilizers. They have a lot of range of motion. And you have knee, that's a stabilizer. And so if you have dysfunction in either the ankle or the hip, the knee usually takes in most of the blunt force. And so what I like to see is first look at the function of the ankle and the hip. So what I'm going to do is I'm going to have you stand up, okay? And we're just going to do a little quick balancing act, right? Okay. First, with your eyes open, I want you to lift one leg, okay? And hold it there. And once you have your stabilized, yep, close your eyes, okay? And stay. And I want to see what your function is as far as the ankle stability. All right, we're going to do the opposite, okay? Open your eyes. And then close. Okay, and as we see that she's able to stay, but you can see the ankle going back and forth really quickly. All right, and you can open them up. So what's happening there is we have three balance components. We have vestibular, we have visual acuity, and we have proprioception, okay? Proprioception is huge because today everything we do, there's so many facets, playing on the phone, moving around, people talking to us, dual task all the time, that if we can't have good proprioception when we move, then that might cause a dysfunction. Second thing I want to do is I want to look at the hips. So I'm going to have you lay down on your back here. And the way I like to do this, I like to use a simple method. First, do a cross crawl. And the way I do that is first I just want this knee to come straight up, okay, and back. And that's what you're going to do. You're going to come forward and then back. And I want you to do that on your own. And what I'm looking for is I want this knee and hip to come straight back. And when I see hip dysfunction, what generally happens, you start seeing this. And the big thing is with these movements, what they think is normal in reality might be two different things. And so I want to sync both of them up. Okay, so I might use something as neuromuscular re-education, where I have this knee come back, okay, come forward. At the same time, I want this hand to come back. Okay, so you're going to move this knee and that hand at the same time. And I want to see come straight up, straight back. Okay? Good. All right, now let's try the other side. And I'm looking for that external rotation. Perfect. Okay? And this is going to come straight. All right. So this simple test, I could see how their movement is in the hip and what stress is occurring at the knee. If that's rotating the way it is, then I could use these bands to actually readjust. Okay, you're going to hold this out. And it's a simple little exercise. Now you're going to do the same thing, where you're going to hold that out. This knee is going to come straight up. Okay. And at the same time, that arm's going to come back. So it's a very, very simple deal, and we're actually going to overstimulate this outside area to make sure that there's no internal rotation. This is kind of emulating walking in a sense, because the way I like to see walking is the ultimate balance sport. As you move from one leg to double support to single support, it's ultimately walking. And so there might be little shakes in between, and as we do that constantly throughout the day, and so if we pick up the pace, we can start causing little dysfunctions, and dysfunctions causes firing patterns. Firing patterns cause muscle imbalance. Muscle imbalance eventually causes pain. Good. All right, so once we have that and we kind of worked on the neuromuscular re-education, what I want to do is I want to work on an ultimate balance ordeal. So you're going to come straight up. Okay, and we're going to do what's called walk the line. And walk the line is doing kind of what we did there on our back, where we're going to come up, balance, forward, okay? And really quickly, boom, come right back up, okay? We're gonna do this both with our eyes open, and then we're gonna try this with our eyes closed. Yep, nice and slow. And I want you to hold this one when you come back up. All right, and what we're looking for is this to be nice and straight and no rotation, no internal or external rotation, okay? And then we bring the ankle back, okay? And this guy comes up. Good, all right? And you can see that this is a straight line. She actually has really good form here. Now we're gonna turn around and we're gonna see how she does with her eyes closed. So we're working on proprioception with movement. A little more difficult, isn't it? Okay, let's turn around so they can see. Okay. Straight up. And you can see as her proprioception occurs, she starts having a little more internal rotation here. Okay, up. Good. All right, come straight down. All right, so how do we work on that? How do we correct it? Usually when I do taping, if I'm working on the ankle, the hip, I look at the focal points. And it might actually be the knee that I want to kind of construct. So we're going to do a simple knee taping. We're going to kind of do this again to where I can kind of work with the fascia and make sure that we can get better proprioception in that area. As we move, we'll be able to become more fluent. Okay, so let's go ahead and have a seat here. Yeah, so we're going to pull this up here. Okay. What I want. All right, you're gonna come all the way back. Good. And always round the edges when we do a tape job. That way it doesn't fray. And I like to put the muscle on stretch when I do this, so that way you have a little recoil effect once you start moving. All right, and all I'm gonna be doing is putting on the lateral sides and maneuvering across, so I don't do any tension at the end. All right, and I just do kind of paper off tension as I come down, roll right over tuberosity there, and place it down. And as I do the internal side, I'm actually going to do just a little bit of tension, so that way I maneuver the fascia. Come back, and all the way down. All right. Really simple, nothing much. I'm just adding a little more stimulation into that area. We're gonna drop this down, okay? We're gonna come up, we're gonna do the kind of the same thing that we did. Eyes closed. Yep. Good, nice and slow. Good. Perfect. All right, let's turn around, let's do the same thing. Okay, good. Come back. Perfect. Awesome. All right, very cool. All right, so that's just kind of the areas that we kind of concentrate on as far as motion-wise, because it's little fixes with the hips and the ankles that can cause major issues if we repetitively move the way we do constantly throughout the day. Another thing that I like to ask or I like to work on is our soleus has a big effect on the recoil. So I like to call the soleus the second heart of the human body because it pumps the blood back up. So it's constantly working. And sometimes it doesn't have the elasticity that it needs. And it pulls either on the fascia, the plantar fascia, or the ACL. And so a quick way to check this out is actually maneuver athletic stance, and you bring your butt all the way to the floor. And what we're looking for is any pick-me-up in the heels. If there's any pick-me-up, that means there's trigger points in the heels. You can come on up. And if there is, we want to work that out. And the quickest way to do that is, here, Go ahead and go on your stomach. Quickest way to do that is just find the hypoxic areas in the calf, bend the knee, and we could do a little MRT. Stretch it out. All right, until we find a nice release, and we get some really good range of motion. The reason I always bend the knee is because the soleus is deeper in the gastroc, and so I want to really get in there and pull it out. And then we're going to do the exact same test. So the exercise is the test, and the test is the exercise. All right, I go medial and lateral. All right, we could also use a quick foam roller, which we have at BioFreeze and TheraBand, which is a quick little test. And we can maneuver. Once we figure out that we have a release, we want to come back up. And we do the same exercise. All the way down. Good. And you can see before she didn't really have much of a problem, but that did come up just a little bit. This time she can go all the way to the floor, almost get her butt down, and the heel doesn't maneuver. She's centered into the balance point, right in the middle, and come back up. And no stress is going up and down. So really, when we look at dysfunction, we want to concentrate on making sure the knee isn't prohibited, okay? So good range of motion in the hip, good range of motion in the ankle, and making sure that the musculatures attached aren't fighting against what you're trying to do with your range of motion, and the knee isn't causing a blunt of the issue. So.